I wanted to ask first how you got into the CIRS space specifically.
So kind of similar to many practitioners in this space, I think, unfortunately, it was through personal experience of CIRS. So I first had symptoms, I guess, that I recognize now in kind of 2015, 2016. Took me a good couple of years to figure out what the problem was after, as many people go through, seeing a multitude of doctors and specialists, finally realizing it was mold from my workplace was the main issue. And then, being diagnosed, going through treatment, which went pretty well initially. And then, unfortunately, even though I had kind of mostly recovered, I had this kind of chronic fatigue relapse, which then took another few years to get myself out of that hole. And, along the way, meant trying to get back to work full time with the fatigue issues, but also with the workplace being, a concern. Eventually, kind of realised that this is not going to be helpful for recovery, and so decided to retrain initially as a health coach, then as a functional nutritionist, and then from there I've kind of done various mold trainings, knowing that that's the space I really wanted to end up in, so I could help people that were, had suffered in the same or were suffering in the same way that I had suffered. And so, one of those trainings being Dr. Shoemaker's Proficiency Partners training. Yeah, so that's kind of how I got into the space. And, it's kind of a win-win, because not only do I get to help people through, a tough time, but I'm also much more in control of my own health because I can, I don't have to go into buildings that are going to cause issues for me, like
Yeah.
the initial workplace did. So yeah,
Well, thank you for sharing that. I think
it's
a
okay.
lot of our listeners will relate to that story of coming to this space through their own journeys, whether they're a practitioner or a patient.